Hi, Dr. Milky back with my trusty foot model. Last time I talked about the area where the metatarsal bones meet the phalanges. And I'm going to stay there, but I'm going to really focus on the big toe joint itself. Obviously, that's where the first metatarsal bone meets the big toe. And there's a lot that can go wrong in that area. So a few things that I see a lot of. One of them is a bunion, of course, and a bunion is bone that builds up on the inside of the foot here. You can get a bunion also on the outside of the foot near the fifth metatarsal, but that's an obvious one. People know when they have that because there's a bump there and it oftentimes can get sore. It's also another place where we see gout. Now, not just with a bunion, but people come in with pain in the big toe joint area, redness and swelling, and I mean, it's really painful. It's really hard to miss gout. I mean, some people even feel pain like if there's a breeze on their foot, it gets that uncomfortable. And for some reason, that's where these uric acid crystals want to deposit themselves in the big toe joint. We don't really know exactly why that happens, but that's the part of the body where gout is the most prevalent. And there's something we can do for that. Oftentimes I'm doing a cortisone shot or sometimes some medication for that. You can get joint problems here where, from an injury or wear and tear or some genetic things, you won't necessarily know what the condition is, but you'll have pain in the big toe joint on the top, inside, the bottom, that whole area where sometimes the cartilage, which is, kind of that clear area in there. So there's, this represents like cartilage here on the metatarsal, and there is cartilage also on the toe part. Just a little piece of cartilage can chip off, which won't necessarily even show up on an x-ray, but it can cause chronic pain in that joint. And then there's the bottom of the foot, and this is not the last one, but this is another one where we don't see them here, but there's two little bones down here called the sesamoid bones. And the sesamoid bones can break, they can become inflamed, they can just hurt from pounding on the foot or certain foot types or certain shoes, or not wearing shoes in the home when you're on hard surfaces can lead to inflammation and pain down in this area here. So there's a lot of different things that can go on in the what we call the first metatarsal phalangeal joint. And it's a big joint because it takes up a lot of stress, and because it has a lot of stress, a lot of things can go wrong with it. So if you're feeling pain in that area and it's persistent, again, don't wait on it. We want to make sure we get the right diagnosis, and we don't want it to turn into something that might need surgery just because you waited too long. There's things that we can do typically to avoid surgery and get the pain to go away quickly, but we got to get the right diagnosis first. And by the way, feel free to forward these to friends, family. We have another number of people that do that, and they're getting some value as well. We'll see you next time.